Hi, I'm Dr. Mark Franke. I'm a board-certified ER physician in Fairfax, Virginia. I'm the medical director for the EMS program at Northern Virginia Community College. This morning, we're going to talk about giving hospital report. It's incredibly important when you're taking care of a patient and bringing them to an emergency room that you're able to convey the information about their patient in a very succinct and adequate manner. The reason for this is that the receiving facility needs to know exactly what they're getting from a patient's injuries or illness so they can adequately prepare the staff and ancillary resources they may need to get ready to receive the patient. It's important that you convey to the hospital what's going on with the patient so they know how to receive the patient, where the patient will go, whether they need to be in a trauma bay, whether they can go to triage, or whether they can go to some alternate place in the ER other than the highest acuity portion. So conveying what's going on with your patient to the triage nurse or to whoever who's receiving that call is incredibly important. And you only have a short period of time to do this typically because most receiving hospitals are very busy. And I'll give you an example. We have a pedestrian that's been struck by a vehicle, and I need to convey the information to the receiving facility. I'm talking to the comm nurse, and I say the following. Hi, this is Mark on Medic 403. I have an 8-year-old male who was struck by a vehicle. He is alert and oriented ×3 now, but has head injury. He has a deformed left ankle and tenderness in the left upper quadrant. His vital signs initially were 80/60, pulse rate of 140, Respir's 26. He is tender in the left upper quadrant with ecchymosis, open fracture of the left ankle that we have splinted. We've given him a 20 cc per kg bolus of normal saline. We've bandaged his head. At this point in time, his vital signs have improved. His GCS remains at 15. We are en route and our ETA is 15 minutes. With that little bit of information there, the receiving hospital knows that this patient is high priority. There probably needs to be a trauma alert, and they'll prepare the trauma team to come take care of this patient. Each time you give report, you need to be able to convey your name, the patient's age, sex, vital signs, injuries, interventions that you've done, repeat vital signs, and how they appear now. So conveying the stability of the patient and what you've done and what they are to expect at the receiving hospital ultimately will make a huge difference in how the patient is received and probably in their outcome. And you can do this in a very short period of time.